Digital pornography use is nearly ubiquitous among adults. Yet, standard clinical diagnostics frequently rely on the volume of consumption as a proxy for dysfunction. This approach relies on a historical, continuum-based assumption common in behavioral addiction research, that low usage is inherently healthy, while high frequency indicates pathology. Empirical data suggests a break in this logic. High-frequency pornography use does not reliably predict emotional distress, relational dysfunction, or a loss of behavioral control. A 2025 study by Chanyi and colleagues proposes a different metric. They suggest the psychological consequences of pornography use are determined by its functional role, specifically whether it serves as an approach-oriented or avoidance-oriented regulation strategy. Relying on behavioral metrics like frequency obscures the actual mechanisms of psychological regulation. Counting sessions or hours leads to inaccurate clinical assessments. The literature identifies two distinct motivational profiles: approach-oriented and avoidance-oriented motives. Positive approach motives like pleasure and curiosity link to adaptive sexual regulation. Negative avoidance motives like distress reduction link to psychological dysregulation and compulsive usage patterns. To test this, researchers analyzed an 890 participant sample to map the specific structural pathways that separate frequent, non-problematic use from dysregulated problematic use. This is the study's initial hypothetical model, built as a structural equation model, or SEM. An SEM is a statistical technique used to examine simultaneous relationships between multiple observed and latent variables. To improve clinical accuracy, science must untangle this web into distinct empirically weighted equations. We can rebuild the empirical data path by starting with a blank slate. On the left, we place the input variables, PUMS positive and PUMS negative. PUMS stands for the Pornography Use Motivation Scale, which is a psychometric instrument designed to measure the specific psychological drivers behind adult content consumption. These domain-specific motives operate distinctly from general human sexual motivation. They reflect context-dependent regulatory behaviors. In the center of the model sit the mediator variables: frequency of pornography use, or FPU, and problematic pornography consumption, or PPCS. Both positive and negative motives positively predict a high frequency of use, with beta values of 0.32 and 0.30. A beta value, or coefficient, measures the strength of the effect an independent variable has on a dependent variable. This shows that frequency is a shared outcome, not a specific pathological marker. Contrast this with the specific, massive correlation of 0.65 between negative avoidance motives and problematic use. Motivation dictates the nature of the consumption. The behavioral pathway splits at the very origin of the impulse. On the right, we add the final outcome nodes: personal goal attainment, sex as coping, and sexual system deactivation. Tracing the adaptive pathway shows how positive motives route directly into frequency of use. From there, frequency routes into personal goal attainment, with a weight of 0.17. This path indicates agentic, intimacy-focused sexual behavior. There is also a critical inverse relationship. High frequency of use actually negatively predicts sexual system deactivation at negative 0.28. Deactivation is the clinical term for emotional withdrawal, for diminished desire, and active avoidance of intimacy in partnered contexts. High-frequency pornography use driven by approach-oriented motives does not shut down relational intimacy. Mathematically, it protects against sexual deactivation. The bottom half of the structural model reveals the dysregulated pathway originating from negative motives. Negative motives route directly to sexual system deactivation at 0.16. Emotional avoidance predictably bleeds into sexual withdrawal. The problematic use node, or PPCS, acts as the primary mediator here. The PPCS is a diagnostic tool that assesses the severity of dysregulated use based on criteria like mood modification and loss of control. Problematic use transmits these distress-driven impulses into sex as coping with a weight of 0.21. This reflects a clinical reality known as experiential avoidance. Experiential avoidance is the psychological tendency to escape or suppress negative thoughts and emotions. Here, sexual behavior is used to suppress negative affect rather than connect with a partner. Problematic pornography use functions structurally as a maladaptive emotion regulation strategy. It is detached from genuine sexual desire. If we isolate the two mediator variables, their differing roles become stark. There is a covariance between frequency and problematic use. They often co-occur, but they perform different jobs. Frequency totally fails to mediate the relationship between negative motives and sexual deactivation. It is structurally inert in the pathology pathway. Problematic use is the active, destructive conduit. It transmits negative motives into coping behaviors. Frequency is merely a behavioral exhaust. Problematic use is the active driver of pathology. Standard diagnostic criteria rely on arbitrary metrics like sessions per week or total hours spent. The data proves these are flawed measures. Practitioners must shift towards sexual motivation mapping during intake. This means assessing for the why, the functional emotion regulation, rather than the how often. Ignoring motivation leads to the clinical risk of over-pathologizing frequent, approach-driven users. Treating healthy behavior as an addiction ruins therapeutic alliances. Misdiagnosis based on frequency stigmatizes healthy sexual exploration, while missing the underlying emotion regulation deficit that actually requires treatment. Abstinence-only interventions fail for dysregulated users because they target the behavior without addressing the functional avoidance driving it. The data supports acceptance and commitment therapy, or ACT. This intervention uses mindfulness to increase psychological flexibility. It specifically targets experiential avoidance, helping patients tolerate emotional discomfort without resorting to compulsive sexual behavior. Dialectical behavior therapy, or DBT, serves as a complementary framework. DBT focuses on teaching distress tolerance and emotional regulation to stop the use of sex as a coping mechanism. While this structural map is robust, its cross-sectional self-reported data restricts absolute causal claims. Pornography use is a mirror of broader psychological regulation. Effective clinical science must treat the engine of emotional avoidance, rather than endlessly counting the exhaust of behavior.